the word holistic. It brings a lot of misnomer, and people start thinking things like you're going to be wearing tie-dye and burning incense and having beads hanging in the doors, and you're going to be using a lot of chanting and things that aren't proven by science. The connection between dentistry and health, and I didn't know it existed. I honestly did. Literally 60 to 80% of chronic diseases comes from or is related to the mouth. And who the biggest detractors are for the kind of dentistry that I do? Dentists.
Exactly.
So, okay, yep, we see that there's a structural, functional issue here. Now let's go do a sleep study. And let's verify what we're finding. We see this. Does it then equate to poor sleep? Does it then equate to poor health? That's a sign. Snoring, 100%. Mouth breathing, 100%. So these are all things that you can look at home and go, wow, I have all of those things. How do the electrolytes flow in and out? They need to be secured. If they flow in and out through water, what else is the water carrying? Is it carrying crud? Is it carrying pesticides and herbicides and other things that are going to totally confuse the way that cell utilizes? There's zero reason to. Fluoride has so many negative side effects. I mean, the IQ decrease in children is enough to convince me. I understand that a root canal could cause health issues, but how can I prove it? The way I'm going to spread this message is I'm going to teach people what they should be asking for in a dentist, what they should be looking for, what they should be demanding, honestly, when they go to a provider. And if enough people are asking it, then the providers are going to have to learn how to provide it.
Welcome everybody to another episode of The Art of Mindful Medicine. I have the pleasure and honor today of hosting someone that I've been following for probably a good couple of years now. So let's jump right into it, and with a very warm welcome. I have Dr. Michelle Jorgensen here, and like I said, I am thrilled to introduce her as a fellow holistic practitioner whose own health crisis actually became the catalyst for revolutionizing her approach to dentistry. And after falling seriously ill from mercury exposure in her traditional practice, Dr. Jorgensen took a bold step back into education, becoming a board-certified holistic health practitioner and therapeutic nutritional counselor. For the past decade, she has pioneered health-based dentistry at Total Care Dental and Wellness in Utah, attracting patients worldwide. Through her platform, Living Well with Dr. Michelle, she shares practical solutions for healthy living, inspired by her passion for teaching, writing, and the belief that the earth provides all we need. I couldn't agree more. And with a significant online presence, something around 219,000 Instagram followers, 173,000 on Facebook, and 88,000 on TikTok, Dr. Jorgensen continues to inspire a global audience while balancing life as a mother, grandmother, and gardener. So, Dr. Jorgensen, Michelle, I appreciate you being on here. It's an honor to have you. And as I was just briefly saying to you before we got started, I've been following you for a couple years as you've been doing things in dentistry in general and in the holistic space longer than I have. So I really do admire and appreciate all the things that you're doing, how you really do have a fully holistic approach from my perspective. And
thank you so much for having me on. I appreciate you.
Of course. And one of my favorite things that you do with your content is that you provide content and then you give a reason and you give some sort of explanation. It's not just like this 10-second tidbit and then it's gone. And like you leave people like, well, wanting more. When yes, obviously people are going to want more, but at least there's an explanation behind things. And I really do appreciate that. So as always, I always like to start things off with gratitude. So, Michelle, if you could please tell us 3 things that you are grateful for today.
Well, I'm sitting here looking out the window at my blackberry patch. And it's very, very abundant currently. So I'm very grateful for just food that is full of electrons and helps my body to do what I ask of it, because I ask a lot of it. So that's the first thing I'm grateful for. I'm also grateful for the chance to share information and for people like you who are willing to let me do that. So thank you for you. I'm grateful for you. And I'm always grateful for my family and those that support me. And we're moving into a Labor Day weekend here when we're recording this. And I have family coming into town. And so I'm just very grateful for that opportunity too.
Beautiful. Beautiful. Thank you. Thank you. So there's a lot of content out there that you've put out there over the years. And I really like people to get to an idea, especially if this is the first time meeting you, so to speak. If we were to gather and compress all that you've produced and accomplished with your life and career into a 1 to 2 sentence mission statement, so to speak, in this particular season of your life, what would that statement be?
Yeah, I can tell it to you exactly. But of course, I don't have it pulled up immediately, or I would have. But really what I like to do is I like to clear a path through the mountains of information that are available today. And there's so much information on every side, and it's often contradictory. So I like to clear a path through the mountains of information and really help people reclaim the ability to help themselves live well. Because a lot of us feel like we can't do it anymore. We have to rely on a supplement or a practitioner or this or that. But no, actually, all of the ability lies with you. You just have to learn how to do it again. So that's what I try to do. Is clear that path, make it easy, and allow you to really help yourself be well.
Absolutely. Thank you. Yeah, it all starts within ourselves, right? So,
Yep.
Beautiful. So now let's go back a little bit to your background. So can you share what initially drew you to dentistry to begin with, and then I guess how you also transitioned into the holistic practice?
Yeah, those are definitely two different pathways. So originally, my father's a dentist, and I was always interested in something related to dentistry or medicine. As a senior in high school, I was the kid that was always top of my class, wanted to do something, and I thought, all right, well, let's find out which way do I want to go. And so I talked to all the doctors that I knew. There were a bunch in our neighborhood. I talked to all the doctors, and the doctors said, be a dentist. And I talked to all the dentists, and they said, be a dentist. And I said, well, the consensus seems to be a dentist, especially, and this was, 30 years ago. They said, well, do you intend to have a family, to, do all of those other things that typically women do? And I said, yeah, those are all on my plans, in my plans. And they said, well, for sure, all the doctors said, for sure, your father has a much better lifestyle than we do. So as a woman, it is an easier path from a practitioner standpoint to be a dentist than to be a doctor. So I said, all right, I guess I'll be a dentist then. So I started down that path quite quickly. And I think back now and think, why in the world did I do this? But I graduated from dental school at the age of 23 years old. So I was a baby. And I think, what in the world was I trying to rush into being responsible for? I've had to be grown up and responsible the whole rest of my life now. What was I thinking? But that's what I've done. So I was very, very happy when I turned 30 and I could finally tell people, I was so tired of people saying, how old are you? I know. So I was so happy when I could say, I'm 30. Thank you very much. I'm old. I've been at this for 7 years already. So that was nice. But I was a general dentist. I was following my father's footsteps. He's very, very active and teaching himself new things and staying at the very forefront of his career. And so I was doing the same thing. We were practicing together. And at that point, I started actually getting really ill. And I didn't know what it was. And so, you'd never look to dentistry for any of the answers, especially not myself. I mean, I was a dentist, but I didn't really connect anything together with health at that point. And so I started asking doctors and, going to all these different things, appointments, and having x-rays and blood tests. And no, there were no answers. I was really struggling with gut health. My brain was just fried. I literally couldn't remember a patient's name from room to room. And I've always had a phenomenal memory. So that was very, very evident change. Something had changed here, but the big one was numbness in my hands. I couldn't hold instruments anymore, and I didn't have the dexterity I needed to do my work. So I actually put my practice for sale, and I thought I was going to have to figure out something else to do with the rest of my life. And like I said, I started early. So this was just mid 30s. I had 4 young kids. This was our income for our entire family. And finally, as I was looking into other options, someone said, have you ever looked into mercury poisoning? And I said, well, no, I don't have any fillings. And I knew that, silver or amalgam fillings have mercury in them. But I said, no, I don't have any fillings. And they just kind of chuckled and said, it's not the fillings you have, it's the fillings you've been drilling out for the last 10 years with no protection. And that was literally the very first time I'd ever heard that that could be a problem for the dentist. And so I thought, well, I don't have anything to lose at this point. I have everything to lose if I can't continue dentistry, but I have nothing to lose to go and research this. And so got a blood test, and that's what it was, mercury poisoning off the charts. So I had to figure out, could I still be a dentist and get better? Could I get all the mercury out and stop putting it in and still be a dentist? How did that work? And I found there were organizations that actually had protocol for this. I didn't even know they existed, like literally had no clue they existed. So I started doing things just for my own health and started changing the way I was removing those fillings just for my own health. But it was very apparent, as any patient who's been through these procedures know, it's very apparent something was different. And I'm walking in with this hazmat, all this kind of crazy mercury filtration masks, and I'm covering them from head to toe. And we got giant vacuums, and they're like, okay, what's going on here? Things got a little wacko. What's happening? So I described what I was doing it for and why, and they were always very thankful because now it was going to be safer for them. And they started to refer me to their doctors and to their friends. And these people were the ones that started teaching me. Doctors would say, well, gosh, have you ever thought about ozone? And I'm like, I don't even know what ozone is, like the ozone layer. I know my hairspray from the 80s supposedly like killed it, but that's all I know about ozone. Like, is there something else I should know here? And, so I literally was taught by these practitioners who would say, no, let us fill you in a little bit. But there were no courses. There were no places to go. I just had to find these weird, obscure little things along the way. And what it did was open my eyes to the connection between dentistry and health. And I didn't know it existed. I honestly didn't. I knew that, gum disease might lead to, blood sugar regulation issues with diabetes, but that was it. Like, that was it. That was all anybody ever talked about. And now I've realized that literally 60 to 80% of chronic disease comes from or is related to the mouth. I mean, it's so huge. So now I can't not see it, and that's entirely shaped my path, is my experience there.
Yeah, I can relate with a lot of that. Fortunately for me, I had not experienced the mercury amalgam poisoning, but I know other practitioners who have. I can also relate to practicing dentistry in my mid-20s and people looking at me like, are you old enough to be here?
Exactly.
Yeah, so I know what that looks like from the upside down position, so to speak.
Yep.
So thank you for sharing all that, and I'm very happy that you found that path to healing yourself. So it's beautiful. So in that transition, because like you kind of alluded to, some of the patients were like, what is going on here? What were some of the major challenges that you encountered when you decided to shift to holistic dentistry? And then how did you navigate some of those other challenges?
Yeah, first of all, the word holistic. It brings a lot of misnomer. When you say holistic, in fact, I remember we put this banner up above the front door, entering into our practice that said something about Total Care Dental, holistic dentistry. And a woman who'd been coming to our practice for years, she came in and she said, if I'd known this was holistic, I would never have come here. And this was a place that, we were just now transitioning to this. And I thought, okay, there's a lot of inferred meaning in that word holistic. And people start thinking things like you're going to be wearing tie-dye and burning incense and having beads hanging in the doors. And, you're going to be using a lot of chanting and, things that aren't proven by science. And that's absolutely the opposite of what our practice is. Our practice is the most technologically advanced dental practice you're going to walk into in the entire, world currently. We have to be, and not only because we really focus on that, but number two, because we have to defend what we do. A traditional dentist, they can just do what they've always done for forever. Nobody's questioning them. But everything we do, we get questioned. So I have to know the latest in research. I mean, I literally know research that came out this week. I have to know that. I have to be up on all of it because I have to be able to say, no, the reason we're doing this is because of this. This is the latest research, was literally released a month ago. This is what it's showing, and that is what's populating what we are providing for you. So that word holistic actually turns people off, I find. So I stopped using it. I mean, we still use it because some people are looking for it. And honestly, the word is good, right? It just means that we're looking at the whole body and, in an entirety, which that's awesome. But for some reason, there's this misnomer about it that it has to do with lack of science and kind of this woo-woo stuff that some people are just really turned off with. So I like to call myself a health-based dentist because it's just super straightforward in what I am. I'm just looking at your health and saying, how can what I do impact it in a positive way? That's it. That's why I call myself health-based dentist. So that was definitely one of the hurdles, was just trying to figure out how to position myself. The next hurdle was exactly what I was describing with the science, is really figuring out what protocols are we going to follow? What are we going to do here? Okay, so I understand that a root canal could cause health issues, but how can I prove it? How can I diagnose this? How can I really stand on my 2 feet and confidently say, yes, this is contributing to what you have going on? How can I do that legally? How can I do that ethically? And all those kinds of things. And so really had to do some major deep dives to figure out, okay, what should we be doing? What does this look like? And what is the best protocol? And we change frequently. We're always adapting based on what things come across the board, And the third thing I think that has really been a challenge, but has been a good challenge for me, is how do we get the word out? And at first I started trying to teach dentists. I thought, let's just get more dentists providing it. And you know who the biggest detractors are for the kind of dentistry that I do? Dentists.
Exactly.
Dentists. And so I decided very quickly, I don't like teaching dentists. I don't like having to defend myself, tooth and nail, every single word I say, even though I'm more researched than they are, I can, but I don't like to do that. That's very contentious. It's not the energy that I really resonate with. I'm very much an abundance mentality, happy, and so I'm not about just going to go stand toe to toe. I can, but I don't enjoy it. And so all of a sudden I decided, you know what? That's not the way to do this. That's not the way I'm going to spread this message. The way I'm going to spread this message is I'm going to teach people what they should be asking for in a dentist, what they should be looking for, what they should be demanding, honestly, when they go to a provider. And if enough people are asking it, then the providers are going to have to learn how to provide it. So that's the backdoor approach that I've taken, because dentists aren't actually very interested in what I have to say. But that's okay, because if enough patients are interested in what I have to say, then some of them will have to stand up and start doing things differently.
Absolutely. Beautiful. I couldn't agree with you more. I have encountered the same exact thing, and I get people messaging me online and emails, Instagram message, all these things all the time, asking how to find a practitioner like this. And I said, it's all about, yes, you have to do some research, you have to understand some things, but it's really all about the questions that you ask. You got to be able to ask good questions and tell if someone is being authentic or not, and generally I find, you've probably had this experience at other dentists that, like the ones you're describing, you can usually tell if someone's interested in the questions that you're asking or not. So you were describing some of what it sounded like to me, like transformative experiences that you're having, like that you guys constantly are shifting from here to there. So what are some of the shifts that you've made over the recent past that might surprise some people?
So one of the big shifts that we've had, there's a couple, but we've just literally have added departments to our practice as well. So our practice is very different from an appearance standpoint than a typical dental practice, and from a personnel or staffing standpoint as well. We're multiple disciplines underneath one roof. And thankfully, where we're at, we've been able to expand to adjacent buildings. So we literally have a campus now of multiple providers and different things. And as we find a need, we then create a new department, hire a new team, and bring it on board. And so the latest one that we've really have delved into is the connection between dentistry and sleep. And so few people recognize it. There are some dentists who have worked to capitalize on this connection, and they do certain appliances that bring the bottom jaw forward. That's the main purpose of these appliances, is they bring the bottom jaw forward, because if there is less room to breathe, bringing the bottom jaw forward does open up that airway space, open up more room to breathe. Unfortunately, it's like hyperextending your knee 8 hours a day. When you hyperextend this jaw 8 hours a day while you're sleeping. And what happens is, what the research is showing is, after about 4 years, there are irreparable joint changes that are happening in those joints when that's all you're doing. So that's really what we had to step back and say, okay, that's not fixing anything. And that's not actually getting the root cause whatsoever. Why is that any different or any better than wearing a CPAP at night? CPAP's just supplemental oxygen. When we hold your jaw forward, all we're doing is basically supplementing your airway. What is that doing? It's not benefiting anybody in that point. So what is actually the root cause reason? And so we've delved deeply into root cause reasons for sleep issues, largely related to functional or structural problems here. So why can you not breathe? Because there's not enough room. And why is there not enough room? Because your mouth's so small. Why is your mouth so small? Because nutrition issues from literally day one have affected your mouth growth. So we talk already to kiddos. We start working on them from a nutrition standpoint, growth and development standpoint. Our goal is that kids never need braces, that they never need to get their wisdom teeth out, that there's plenty of room to breathe. There's no ADHD symptoms related to oxygen deficits. Kiddos aren't bedwetting at nighttime because they don't have these excess ammonia buildup because they can't breathe. I mean, all of these things, like literally I'm skimming just the very surface of a big concept, but this is a huge one that affects literally 80% of the population is sleeping efficiency. And we figured out that there's an enormous connection to dentistry and things we can do root cause based that correct the problem rather than just band-aid it. So that's one of the huge modifications we've made just in the last year or so in our practice.
Yeah. And I couldn't agree with you more. And getting down to the root cause, because I can actually argue that utilizing CPAP machines and those protrusive devices actually make the problem worse. Because like you said, it causes the reconfiguration of the jaw. I mean, and it actually can make the muscles in the back of your throat and your jaw weaker because you don't have to use them at all.
Yep.
So, okay, beautiful. Now, so maybe give us an example of how would you get to the root cause of something like that, a situation like that? Because I know I see this and hear this all the time.
Yeah. So it's interesting. Now in my practice, my job full time is the new patient intake. So I just see new patients. Anytime I'm in the practice, that's all I'm doing. I'm not doing any of the fillings anymore. I'm not doing any of the surgery. I've done that for years, for decades. I did all of that. And now, since I have some additional training in the medical side, I just put all those pieces together. So every single patient that comes through our practice gets a cone beam CT scan. And people say, well, what is this? And how does this compare to a CT scan you're going to get in the hospital? Very different from a radiation standpoint. The amount of radiation, it's much reduced than a regular typical CT scan. And it's head specific. So what I want to see is I want to see eyebrows to chin. That's what I want to see on you is eyebrows to chin. So we do an eyebrows to chin CT scan, cone beam CT scan. And on that, we're able to identify a lot of things. So what we see are infections, first of all, head and neck infections. So we're going to see if there's any infection underneath an old root canal. And does that happen frequently? Every single day. Multiple times every single day. And these are often asymptomatic. People don't even know. They don't hurt. Well, I'm going to retract that statement. They're not asymptomatic. They're asymptomatic locally, meaning they don't have a local symptom. Nothing hurts. They can't pinpoint. Sometimes they'll say it just doesn't feel right or doesn't feel normal, that kind of thing. But there are symptoms. They're the autoimmune disease they're suffering with, the joint problems they have, they're, all these other issues. So we see infections, root canals, failed root canals, but also where teeth were removed that didn't heal right. We also can see any sort of jaw changes that have occurred because of airway problems. So we'll see jaw joint changes actually in the joint itself. We'll see extra bumps of bone growing at the corners of the jaw, underneath the tongue, all these different areas based on airway problems. And then we actually can see the tube you breathe through, and we can measure it and say, okay, how big is it? And if it's this size, why is it too small? Why is it smaller than it should be? Oh, look, the tongue sitting way back there into the airway. The tissue is all thickened up there in the roof of the mouth because of the infections in the mouth. All of this is in the way. So we identify it there. That's where we screen and we go, okay, yep, we see that there's a structural, functional issue here. Now let's go do a sleep study. Let's go do a sleep study and let's verify what we're finding. We see this. Does it then equate to poor sleep? Does it then equate to poor health? What does it equate to? And so there's sometimes secondary testing that we do to validify what we see on the CT scan. But a lot of things, we go straight off that CT scan. Infections and things in the mouth, those are straight from the CT scan, right to treatment. So that is gold standard in health-based dentistry. You must have a cone beam CT scan. And it's interesting. I was just on the phone with a up-and-coming health-based dentist, she's in, where is she? I'm trying to remember where she's located. I believe she's in Texas. And she's just working for the doctor that owns the practice. And she said, well, tell me about your new patient process. So I walked her through exactly what we do. And she said, oh, we don't take a cone beam CT scan every time, because we only take it if like people have a concern with a root canal. And I said, then you're missing probably 80% of what you need to actually be caring for. And she was like, oh, but I'm not the owner. I said, well, then you can go talk to the owner, because you guys are missing a lot of care. So that is gold standard. You really simply can't find out what's going on in the mouth without it.
Yeah, I couldn't agree with you more. I offer that to every single new patient that I see, and very often they oblige, and more often than not, we definitely see issues.
Yep.
So,
yep.
So that's more on your side of things when it comes to this breathing issue, but not, like, as you've alluded to, not a lot of dentists are screening for these things. And when they are, they're not necessarily looking for things the right way. What are one or two things that people can maybe notice in themselves that they're doing that they might be able to come with these good questions to a practitioner?
Yep. Excellent. So from a breathing standpoint, the things you're going to notice are you can't go to sleep. So you lay there at night for hours. You can't stay asleep. So you go sleep fine, but then you're going to wake up at, 1 a.m. You're awake for an hour. You wake up again at 3. You're awake for another, just that miserable, I can't stay asleep, toss and turn. So you wake up in the morning and your bed looks like a tornado hit it. Those are all things. You wake up multiple times to go to the bathroom. And people will say, oh, no, I just wake up to go to the bathroom. Well, here's the tricky thing. There's actually a hormone pathway that turns off the urge to go to the bathroom at night if you're really, truly in deep sleep. So if you're waking up to go to the bathroom, you're actually waking up, then you're going to the bathroom. You're not waking up to go to the bathroom. So you're already waking up. Focus issues. So ADHD symptoms. Those are hugely related to this. Fatigue, just that generalized, I woke up in the morning, I felt like I slept okay, but why am I just blitzed? Why do I just feel terrible? If you sit down in the afternoon, you can fall asleep in a split second. Anytime you sit down, you fall asleep. That's a sign. Snoring, 100%. Mouth breathing, 100%. So these are all things that you can look at home and go, wow, I have all of those things. I feel super tired. My wife tells me I snore, and I just can't stay asleep at night. It's so hard. I actually dread going to bed because I know I'm just going to fight all night long. Those are all things to watch for.
Yes, thank you. Beautifully described. And I wanted to shift a little bit into the different topic that is close to me, and that's mindfulness. And how would you say, for you, how would you define mindfulness? What does it mean to you personally and professionally?
It's a great question. Mindfulness, personally for me, I learned a long time ago that I actually had to stop listening to other people's voices in my head. And I know a lot of people today, they constantly have someone else's voice in their head through podcasts, through music, whatever it is. They've always got their AirPod in their ear, and there's always somebody else's voice in their head. And I had a coach years ago, and she said, stop listening. I love to read books. You can see all the books behind me. I love to read books. She said, stop reading. Just stop listening and stop reading for a little while. Because if you're constantly filling your mind with other people's words, where is the room for your own? So I just stopped listening, and I stopped reading for a little while, and it was kind of against my nature to do that. And I just started paying attention to what was going on in my own head, what was going on in my own mind. And it was pretty incredible what actually was there once I just gave it room to bloom, gave it room and started writing things down. And all of a sudden I would have these streams of thoughts that would come day in and night. I had, notebook sitting by the side of my bed, notebook in my bathroom for when you get all these thoughts in the shower. Why do you get thoughts in the shower? Well, because you've turned off all the other words. You've given your mind a chance to think, So mindfulness to me is actually paying attention to what's going on in my mind. Professionally, mindfulness is actually, I use a lot of this in my profession. My team knows. So I work with, we call them care coordinators in our team. And they always are there with me. Anytime I'm with a new patient, there's a care coordinator with me, and they take the patient through the next steps in their care. And they know my mannerisms very well by now. And so I'll start talking with someone and I will be explaining a procedure. I'll be talking about, let's say they have, a certain autoimmune condition, and I'm discussing this. And all of a sudden I just pause for a second. I'm like, okay, yeah, actually you need to do this. And my team just knows not to comment, not to say anything. They just know that I'm listening to what's going on in my head, that there's answers there. And if I don't stop and I don't give them a little bit of room, then I'm not going to be able to access them. But I 100% believe that we know so much. It's all in our heads. It's all in there. And there's greater power that's also delivering a lot of that information to us. We've just got to give it space. So that's the way I do it. That's the way I think about it.
Yeah, I love that. And do you have any practices that you personally use currently, and how do they influence the way you approach dentistry?
So every morning I always have prayer and scripture reading. That's the first part of my day, every single day. And I do it personally. We also do it with our family. Actually, I have a fun, I guess it's fun. It is fun activity that we do with our family every single morning. Now I'm on the tail end of kiddos. My youngest is actually a senior in high school right now. So we've had houses full of kids, down to, one time we had 9 people in our home, and now we're down to just, there's 3 of us. And so it's very much changed, but this is something we've done for years. I use something called Insight Timer, and it's just a free thing you can get on your phone, and it has a timer you can set. So we have a 6 or 7 minutes, 7 minutes. We do 2 minutes of scripture reading, and then we do a minute of writing down what we're grateful for the day. We do a minute of who we want to be thinking about for the day. And then we do 2 minutes of prayer. Actually, that's going to only be 6. So that's 6. And then we do 2 minutes of prayer, personal prayer. And then the thing dings at each time, which is great. It dings at the 2 minutes. It dings at the 1, then the 1, then the 2. And then we know where we're done. And then we all sit up and we all, finish our prayer, and we say, what is one thing that we saw the hand of God in our life yesterday, or the hand of whomever you want to believe in? We share that with each other. We share a little bit about what we just learned, and then we're done. It's literally a 10-minute or less practice that we do every single morning, but it just connects us to the divine, and it connects us to each other. So that's something that we do every single day. And that along with, I run with a couple phenomenal women in the morning. They're my therapists, and we often have therapy session. And I bring a lot of those insights and a lot of that to practice. I share that with my team. I share that with my patients. And I just, like I said, I just allow space for it to be there.
Yeah, that's beautiful. And like you said, it helps connect you to one another. It connects you to the divine, as you said. And then really the other thing I was thinking is that to oneself, it really keeps you in touch with what's present for you. So thank you for that. And has mindfulness changed the way you engage with your patients over the years? And what impact do you believe it has on their healing process?
Oh, 100% it's changed the way, I think a lot of times as a practitioner, we're trained and believe that we have to know all the answers, and that people are looking at us to know all the answers. And if we don't, then we're failing, and we have to tell them at least something. Well, I actually don't believe that's true. I think that sometimes, if we're making things up, or if we're stretching, or, then that's actually not serving anybody. So the way it's actually changed, probably the way I approach practice and patients the most, is no one loves to come to the dentist. I mean, there's a few kids who say, I just love it here, but very few people really just, look forward to going to the dentist. So if that's the case, if someone's going to come to the dentist, they have to have a reason, right?
Yeah.
Thing that they want. There's something that they want. And my job as a practitioner is to help them get that thing. That's it. Like, my job isn't to sell them things. My job isn't to, people will say things like, oh, you're just trying to get a new boat. I'm like, I don't have a boat. Thank you. I really appreciate that. But actually, the bigger reason I'm here is because I want to help you get what you want. Do you want a boat? I don't, it actually has nothing to do with me. So I approach patient care so much differently. it's just all about them. What do patients do? What is somebody coming to the dentist for? Not for fun. So it has to be something else. What is the reason they're there, and how can I help them get that? And so I tap in a lot. Again, my team members, they just know when I pause, when I look up to you look up to the left. When you're looking up to the left, you're looking for memory bank. When you're looking, these things that I look up into the air, they just know, just wait. She's getting some information. I'm like, okay, yep, that's way back in the file cabinet. Let me go see if I can find it. All right, I'm going to find it. It's there somewhere, but I just really listen. I listen and I take time. And the other day, it cracked me up. I was talking with a patient. I was sharing some things and I was listening and trying to get what she needed. And she's like, oh my gosh, Dr. Michelle. She's like, I feel like I need popcorn right now. Like, this is fascinating to watch you, to listen to you and to watch you just like pull this information out of the air. And she's like, where's the popcorn? I'm just like so interested in all of this. And I was like, that is hilarious. Actually, it's one of my favorite comments ever. But it is, it's just like this. We're just sharing, like we're just reaching into the universe for insight. They can feel it. And it's just totally changed. I don't have to know everything, and I don't know everything, but I can find the answers.
Exactly. I've had that same exact conversation with people. And I also refer to going back in the filing cabinet because that's exactly what it feels like.
Yep.
Yeah. So thank you. And a lot of this, what you're describing, it seems like it comes from your core philosophy, that's just deep within you that you've kind of enriched, so to speak. Can you share the core principles that guide your holistic approach and how it differs from the conventional methods that we see?
For sure. So take my story, for example. When I was visiting doctors, they were looking for something to patch up my problem. So I had gut issues. Well, what are they going to do for my gut issues? They're going to prescribe a purple pill. The time it was a prescription, now you can get it over the counter. They're going to do a scope and go look and see, what was going on down there. They were going, do those kinds of things. For my numbness, they want to do surgery. They thought, oh, it's called thoracic outlet syndrome. There's something obstructing, pinching. What's going on back up in here? Let's do some surgery. Let's open things up. Well, all of that was focused on symptoms, right? Every single bit of that was focused on symptoms. And that's typically the care that everybody else is getting everywhere too, is it's focused on symptoms and symptomology. If you're treating symptoms, you're simply dealing with the warning lights your body's giving you, the warning signs your body's giving you. You're just turning off the light. I equate it to if you have your car and you're driving down the road and one of those little check engine light comes on and you pull over and you disconnect the fuse. The light's no longer on. But it's problem has not gone away, Taking ibuprofen for a headache is disconnecting the fuse. The reason the headache came didn't get addressed whatsoever, but the light's out. So then you just pull back on the road and you drive on feeling good about yourself because there's no more light. But all you've done is disconnect the fuse. So my philosophy is all about finding why the engine light's on to begin with. And it all goes back to cell health. Everything's about cells. And if you can help one cell be well, you can help every cell be well. And that's really what I focus on now is, okay, what does a cell need? In fact, this is coming out of my new book soon, but I will tell you about it. It's called the Cell Well Model. There's 4 things that every cell needs. It has to have a certain supply of things. So cells need nutrients. They need electrolytes. They need certain things to be able to actually fire correctly. They need glucose. They need oxygen. They need water. What do they need? How do you actually get it to them? They need to be supported. So how can you manage, say, those electrolytes? How do the electrolytes flow in and out? They need to be secured. If they flow in and out through water, what else is the water carrying? Is it carrying crud? Is it carrying pesticides and herbicides and other things that are going to totally confuse the way that cell utilizes that water? And they need to have correct signaling. So what are cell signals? Like, what is that even about? How do our cells work? Is there literally electricity in our body? How does that work? So those are the 4 things that the cells need. And if you can provide those 4 things, you can literally correct any other health issue in the body, and it's root cause addressed. It's going down to the reason that you don't feel well. not just disconnecting the fuse on the check engine light. So that is my core philosophy, is you've got to get all the way to what's happening at the cells, and then you work backward in the body and you help the body heal itself. And the body has to do the work. As a doctor, we do nothing. We just provide the body with what it needs to actually do the job.
Yeah, I completely agree. And I have a very similar conversation with patients where it's like people come, like you can line up 10 people with the same diagnosis, and it doesn't mean that what's causing their symptoms, even though the symptoms might be overlapping, does not necessarily mean that it's the same issue for each one of those people or any of those people. So completely agree. And thank you for walking us through that. Looking forward to the new book. You can give a little plug here if you want. What's the name of it?
Yes, it's called, this is the craziest thing. It's almost a little embarrassing for me. We went through about 15 different book titles with the publisher, and they have settled on Living Well with Dr. Michelle, which is my platform, which is everything else. I mean, it was not the title it was going to be. And they're like, it is what it is. It is what it is. Living Well with Dr. Michelle. And basically it's helping people reclaim their ability to live well with unlimited energy and unlimited health. So that's what it is. It should be available for pre-order in October, and it's going to be released next spring. So it literally will walk you through how to help your body and cells be well.
Excellent. Beautiful. I like the name. So it definitely has the right ring to it. So
thank you.
Of course. So now that we've kind of got a little bit more into your philosophy and how you approach things, what is your I guess approach to educating your patients on the benefits of these types of practices and these philosophies, and what strategies do you use to empower them in their health journey?
I find that more often than not, people are confused, frustrated, and overwhelmed. They've been to so many different doctors, they just don't even know who to listen to anymore. And there is a lot of research showing how much information we actually assimilate through hearing, through verbal information. And it's much lower than we would all hope for, especially those of us who are trying to teach through audio media like podcasting. And, people will learn some things, but they're going to get about 30, maybe 40%, probably even less than that of what we say. It's just not going to work. So what I like to do is I like to show people, because visually we are going to pick up the pieces that we don't get audioly. So audioly, that's not a word, auditorily. So what we don't get through the ears, we're going to get through the eyes or through body language, and that's visually as well. So I use a lot of pictures. I use a lot of tell, show, do. When I have a CT scan, I will pull that up in front of the patient. I will draw or, show them on an illustration. What is a root canal? What even is it? And what actually happens to lead to root canal failure? I draw it for them and they see it. And I say, so this is what we're looking at on the CT scan. We're looking at this dark halo right down here. And then we turn to their CT scan and I say, now let's look for some. Let's go look at your root canals. Let's go see. You tell me if you see it. So it's more of they are discovering right along with me. And we are kind of detectives working side by side on this, rather than me just talking at them. There was a very classic study done. I believe it was Dr. Dean Ornish done. This is years ago, decades ago. And he was studying people who had had heart attacks, near fatal heart attacks. And they were doing dietary instruction for them, telling them, you can't eat this, you can't eat this, you can't eat this, you can't eat this, otherwise you're going to die. And what he found is a very small percentage of people actually did what they said. And he's like, this is literally a life or death situation. Why are people not doing it? Because just telling you you're going to die is actually not motivating. So what he instead figured out is he talked to them and he said, what do you want to live for? Well, my grandson is in kindergarten. I would love to see him graduate from high school. Okay, great. How many years is that? 12 years. All right. You want to live 12 more years. You just had a massive heart attack. What is it going to take for you to be able to see your grandson graduate from high school? And all of a sudden, he saw behavior change. He saw people taking ownership of where they were and where they wanted to be, because it was something to live for. So that's my huge emphasis on education as well. I actually don't like even calling it education, because we always, as practitioners, we kind of go, oh, they're just not educated. Well, no, if they were educated, then this is the common one. People will say, would a doctor ever smoke a cigarette?
I mean,
Because
I've seen it plenty. So
so if it was all education, well, that doctor just must not be educated. Well, no, they are. They know that cigarette isn't good for their health, but they're still choosing to do it. I mean, we know now, I mean, would anybody ever eat a Big Mac and fries and a milkshake? Because do we know that isn't really that good for our bodies? Yeah. So if it's all just about education, there's a lot of things we wouldn't do. It's not about education, it's about motivation. So that's what I get to with the patient. Again, I get to, why are you here? You're not here for fun. So why are you here? Let's together figure out how to get you where you're going, because I want to know why you want to get there. What is it? Why are you really here? And where are you trying to go? And how can we get there together? Sure, I'm going to teach about root canals. Sure, I'm going to teach about mercury. Sure, I'm going to teach about fluoride. I'm going to teach about breathing. I'm going to teach about all this. But instead, it's about, you actually want to be able to get down on the floor and play with your grandbabies. I see that. You want to be able to walk those stairs without those knees aching every single step. I get that. You want to be able to wake up in the morning and feel like you're ready to go and actually exercise. I get that too. So that is the way I work with my patients, is we figure out where you want to go and can I help you get there, rather than teach you all about the things you're going to do.
Yeah, I just to kind of put the last hammer on that nail. I have my own very close personal experiences with both of those kind of examples. My mom's an ICU nurse, and thankfully she's getting ready to retire. But when I was little, they used to have this. I don't know if they still do this, but they bring your kids to work day.
Yep.
And my mom would bring me to the hospital sometimes, and I would sit in the ICU unit for, I don't remember how long I was there for, but I just distinctly remember seeing doctors standing outside the hospital smoking cigarettes.
Mm-hmm.
And even as a little kid, I would go to my mom like, isn't that bad for you? Like, just as a little kid, I think I was in elementary school. You just know that. So there you go. Just to kind of hammer away one of your points.
Yep.
And the other one is this one's really close to me. This is about my father, actually. He has some of his own chronic health issues. And, I've come to the realization, after many other people much wiser than I have said these types of things, that you can't change anybody. Nope. It's hard enough to change ourselves.
Yep.
And I mean, I spent, years ago, it's like, I don't know how many conversations and hours talking to my dad about changing some of his patterns in life. And why don't you want to be healthier? Don't you want to live? Don't you want this to not be the end of you? Kind of like what we witnessed in your father. It's like, it just seems so obvious, but it wasn't until and I didn't know, I know about Dr. Dean Ornish, but I did not know specifically about that detail that you just said about this study. But I just, one day it came to me and said, don't you want to get to know your grandkids?
Mm-hmm.
Like, I'm not a father yet, but like, don't you want to see my children? Don't you want to get to know them? Don't you want those things? And since that day, he has made so many positive changes. And I mean, obviously he's still dealing with chronic illness, but he is in a way better place than he was, whatever that 2 years ago or whatever it was that I had the conversation with him. So those are 2 points that you just made that are, in my personal experience, 100% true. And I couldn't agree with you anymore. So if anybody had any doubts about those things, I mean, please engage with that. So
yep.
Thank you. So you started to touch on some of the holistic treatments or whole wellness treatments that you have it in your practice. So what are some of these methods that you're most passionate about, and why do you believe they're essential to modern dentistry?
One of the ones that actually has just come up literally this last week is fluoride. And that's one that's a holy grail or a sacred cow inside of dentistry. And it was really interesting. There was a brand new study that just came out showing that higher levels of fluoride lead to neurodevelopmental issues in children, including decreased IQ. And this actually the research study was done a year ago, but it was just picked up by national media. And so all of a sudden I'm seeing on some forums, dental forums, dentists saying, oh no, how do we defend ourselves against this? And I said, why would you want to defend yourself against it? There's alternatives now to fluoride. There's no reason to defend fluoride. You don't have to die on that mountaintop anymore. So, that's one of the biggies. And the option or the alternative is hydroxyapatite. We didn't used to have this, but now we have hydroxyapatite that is literally the mineral that your teeth and bones are made of. And research shows that it is as or more effective than fluoride at decreasing tooth decay and remineralizing teeth, actually getting rid of cavities that have already just started. So why in the world would we defend fluoride anymore? There's zero reason to. Fluoride has so many negative side effects. I mean, the IQ decrease in children is enough to convince me, but I can list off about 5 more that are really worrisome. Why? Why do it? We have an alternative that's called hydroxyapatite. It's literally mineral complex. So I created an entire line of tooth powders and mouthwashes for this reason, because you don't have to use fluoride. So that's a big one that I'm most definitely passionate about. Another one that I'm hugely passionate about is root canals. And there's information, if you want to check this out online, about how the connection between root canals, basically a root canal is a dead tooth, the dead organ that's left in your body. And I often joke and say, well, let's say your gallbladder, the doctor said, you've got to get your gallbladder out. So they took it out, they cleaned out all the stones, they freshened it up a bit and threw it back in your body and sewed you back up again. Well, how would that go? Not really that great. Your body, the bugs are always going to find that dead tissue. There's no blood flow to that anymore. There's no immune flow to that. So that means no immune cells can get there. So bugs are going to find it. Your body can't defend it. You're going to have a massive infection. Well, that's what a root canal tooth is. It's a dead organ that's left in your body and that your body can't defend anymore because there's no blood flow. So basically these hidden infections hang out in the body. They cause all sorts of immune problems and lead to all sorts of disease. So that's another biggie that we talk about, along with that safe mercury removal piece. If you're going to get mercury fillings out, which I recommend you do it safely. Otherwise, you're just going to fill your brain with a whole bunch more mercury. And that's what was wrong with my brain. Is mercury on the brain means your brain doesn't work anymore. So you don't want to do that. So you absolutely need to get those fillings removed safely. So those are the big 3 that I tackle, is mercury, root canals, and breathing, which we already talked about. And then the fluoride is just that extra little bonus one that I love to talk about because it's just a no-brainer.
Yeah. And are there any other practices or procedures in dentistry that you think could be dangerous for someone's health?
Yes. The other one that I see is areas where teeth were removed. They don't always heal properly, and they can also lead to that dead zone in the bone that can affect hormone health, overall health, and gum disease, which is honestly, gum disease is so well researched, so talked about. It's not a new shiny toy, to talk about gum disease, but it's still something that we see on a daily basis. The other one actually it's not necessarily dangerous, but why do people get cavities? Everybody thinks it's just because they're not brushing their teeth, but I see people day in and day out that brush their teeth still get cavities. And they tell me, I look in their mouth, I say, oh boy, you're the kid who's always had a cavity, aren't you? They're like, how can you tell? I'm like, I can tell because your whole mouth is full of fillings. They're like, oh yeah, it was so depressing. Every single time I go to the dentist, I have 2 more cavities. Well, we figure out why. And usually it's a gut function issue. It has very little to do with the way you're brushing your teeth. I mean, yes, you need to brush your teeth. Don't stop that. But it has way more to do with the way you're absorbing and getting nutrients. So we delve into that deeply. And that's another, again, kind of sacred cow that dentistry has defended for a long time. No, there's other things other than just brushing.
Yeah, that is another complex issue. So thank you for touching on that. Are there any other current challenges that you encounter when it comes to holistic dentistry?
There's always challenges. I mean, just recently I had actually, this was an interesting story. I had the Department of Professional Licensing in the state that I practice in contact me and said that we just had somebody with a complaint against you saying that you are claiming to be a traditional naturopath. And what is your certification? What is your, proof of all that? And this was the interesting thing about this complaint. So the researcher, whomever works for the state, that was emailing me about this said, can you please provide me with your documentation? And as a side note, I've looked at all of your information online, and I would actually like to book an appointment with you as soon as we get this investigation through. So I sent this to my partner, and she's like, can we frame this? Once this is and I said, please. So I sent in my documentation, my birth certification, all my information. He said, okay, case closed. I'll be calling your office to book an appointment now. So we still get so many people just questioning us that I just have to stay on my toes. I have to stay on my toes, but it's okay, because I stay on my toes because I can help people with that as well. I can help benefit their life and improve their health because I know my stuff. And because I know my stuff, I can also tell them what they need to look for in other dentists. We've created a directory online. So on my livingwellwithdrmichelle.com site, we have a directory online of dentists that are like-minded, and you can go find dentists throughout the country. Please tell your dentist to sit up and pay attention to some of these things and start realizing how dentistry impacts health, because it's enormous.
Wonderful. I'm going to get on that.
Yes, that actually. Yes. Yep.
Okay, so we've talked about your past. We've talked about a lot of the things that you do now, and what I'm curious about is future. So looking ahead, where do you see holistic dentistry moving in, say, the next 5 to 10 years, and how do you plan to contribute to that future?
Yeah, so my future is broadening a little bit. So this book that's being released is not about dentistry, although it talks a lot about dentistry. I talk about the element of air, and then I discuss the sleep issue. I talk about the element of the earth, and I talk about mercury and my issues there. So I talk a lot about this in the book, but it's not about dentistry entirely. So my future, my personal future, is that I am going to be helping people see the connection between the two, but also how simple health actually can be when you get just down to the very basics of how the body works. So that is my future. And in my future, I will have a show. I've often joked that I am the combination between Martha Stewart and Dr. Oz. So we will be gardening together and cooking together and doing all these things. It will happen. And if I talk about it enough, it will happen. So it's going to happen. And you will all be able to live well with Dr. Michelle in many different ways. And what I really hope that does is brings holistic, or what I like to call health-based dentistry, to the forefront and bring it out of obscurity, take it out of that tie-dye, incense burning, beads on the door, era, into, no, this is actually real health care. This is what real health care looks like. And what we were doing before was simply being tooth mechanics. We were plugging holes, cleaning up holes and plugging them. Well, the person that, fills the potholes on your road does the same thing. Well, dentists have more responsibility, have more training, have more opportunity than just plugging holes. That's what we do on the road when we get holes in the road, potholes in the road. We're more than that. We're more important than that. And dentists need to step up and take that role, and patients need to start demanding it of us as well. So that's where I see health-based dentistry going also.
Yeah, thank you for saying those things. I'm completely in agreement. And, I've jumped around in my own practice until I've solidified my place where I'm at now and being a partner. But what you just described is just that to me, in my experience, it just seems to be the majority. It's just looking for the potholes and trying to fill them.
Yep.
So, and so people that are maybe new to this lifestyle, what advice would you give those that are considering a shift to more of a holistic or wellness-based lifestyle and practice?
Find somebody that you can really learn from. Buy my book. It's coming out soon. And it's going to walk you very, very simply through what are the first steps. And that, honestly, like I said at the beginning, my job is just to help navigate through the mountains of information that surround us every day. And so I get very simple. Very step one is this. And that's really the key, is decide your why. Why is it that you want to change? What's your why? And then find your first step.
Beautiful. Beautiful. Michelle, I'm very grateful to have you on here. I really appreciate your time, insights, and all the things that you provide for others, really. Um, is there anywhere in particular that you would point people to that they can find you and your future, your book that's coming out, and any other things that you have going on?
Yep. So livingwellwithdrmichelle.com is where you're going to find so many things, lots of research on there, lots of free things. Just go check it out. There's products on there as well that I've been talking about. That's where the book's going to be introduced. So sign up as a subscriber on there because you're going to get all the information, everything. And then my practice is called totalcaredental.com. If you're anywhere local to Utah, that's where I'm located. We'd love to see you. And we also would love to send you to someone else that's not local here. So go to that Living Well with Dr. Michelle site. There's a dental directory on there, and we will help you find someone that's closer to home for you.
Thank you. I appreciate that. And, just the way you say those things, from my perspective, we haven't gotten to know each other very well, but just our interacting and the things that I've seen you put out online, it seems to me that instead of you seeking the hearts and minds of others, so to speak, it seems that you kind of began this journey with opening your own heart and mind to others.
Yep.
And I really do appreciate that. I haven't encountered it as much as I'd like, let's put it that way, in life. So I really appreciate you for doing these things and for coming on here and sharing these things with everybody. And you're continuing to do so. And what your goals are for the future, I think are beautiful. I'm big into gardening and agriculture and stuff too. So that was actually one of the first video I ever saw of you actually out in the garden. And I was like, oh man, this lady and I, like, we would really get along. Like we really do see life through a very similar lens.
Yep.
So it was great. And that really, I was like, I'm going to have her on the podcast today. No doubt. So I really appreciate you being on here. And last question, just to kind of sum things up, I always like to leave people with this. So if this were the last time you ever had to share your thoughts and you could only share 3 things that people should start implementing in their lives immediately to improve their health, what would they be?
So grounding is number 1 because it's so simple. Literally just go touch the earth. Every single one of our cells runs on electricity. And if you do not provide your cells with electricity, they cannot run. It's just how it is. And the earth is one of the greatest sources of electricity there is. So go put your feet on the ground, go walk on the grass. There are also grounding sheets, grounding pads, grounding everything you can do to actually connect with the earth. So that's number 1. Take fluoride out of your life. Fluoride changes so many things in your life. Take fluoride out of your life. It's simple to do. There are options now that have hydroxyapatite. There is no reason to have fluoride in anything ever again. And the third one is to literally change your mindset, because it's mindset. We might as well throw the last one in. Change your mindset to one of abundance. There is enough in the world for everyone. There is enough for of everything for everyone. And when you start seeing it that way, you'll find that you're right.
Beautiful. I completely agree with all 3 of those. Dr. Michelle Jorgensen, thank you very, very much. Again, everybody that's listening and watching, you can find Dr. Jorgensen on Instagram at Living Well with Dr. Michelle, her website, livingwellwithdrmichelle.com. Please go check those things out. Again, check out the future book, same name. Thank you all for joining me and us for another episode of The Art of Mindful Medicine. Click all those buttons down there, the like, subscribe, and share, because that's how we get to do more of these things and spread the word. Because like Dr. Michelle said, the point is to share and get the word out about these types of things. So you are all part of that journey as well. And you can see all past and future episodes on my YouTube channel, Spotify, and Apple podcast platforms. You can also check out my website, which is just the words mindful.doctor. And as I always like to do, I will end with a quote. And this is from Hippocrates. And he said, "Nature itself is the best physician. It heals 3/4 of all diseases and never speaks ill of its colleagues." So I thought that was wonderful. Thank you all again, and have a beautiful day or night wherever you are. All right. So There we go. Thank you very much. I appreciate that. That was wonderful. I hope that timing ran pretty well. And yeah, I'm interested to looking into this database that you've created, and I would absolutely love to stay in touch with you. I mean, like I said, we are definitely of the same, looking through the same lens here.
Yes.
And I'm carving my own path, but also trying to, I'm very open-minded, and I like to take from all the people and I love learning. But it's funny you mentioned that creating that space for yourself to really have your own thoughts. And I have struggled with that in the past, because I want more information, but it is very important. I have gotten much better at it. And it, not only does it help create like the own insights and thoughts from me, but it also just helps me recalibrate and rebalance and kind of reset things.
100%.
So,
yep. Good stuff.
Awesome.
Okay. All right. Thank you. Have a fabulous weekend.
Thank you. You do the same.
Okay, bye-bye.
Bye-bye.